I was having trouble with a failing dental appliance, and I'd had it 25, 30 years ago, and it was coming apart.
When I met Brenda, she was in a tough spot. She had a bridge that basically attached all of the remaining teeth she had in her upper jaw together, and that bridge was falling apart and falling out. There was no turning back. There was no further repair available. After talking through the options, together we decided that the best treatment for her would be an upper all-on-4 surgery. This allows for her to have permanent teeth placed on the day of surgery.
Well, Dr. Vickers made me feel at ease almost from the very beginning. He made sure that I knew exactly what was going to happen. And he showed me models. He gave me a timeline. I think that's a lot of people want to know, how long is this going to take? He was very explicit about the procedures and how many times I would come to the office. So that made everything, going in, knowing what was going to happen, that made me feel good. I knew that he was going to take good care of me.
Her surgery went great. We used technology to guide the placement of the implants so that she can have the most long-lasting and predictable result. Now that Brenda has her permanent bridge, she doesn't have to worry about her upper teeth anymore. She's able to be out and about, she's a social butterfly, and she's living the way that she deserves to live.
Dr. Vickers is an excellent oral surgeon. I feel very fortunate that I was blessed to meet Dr. Vickers, because I believe that he did the very best job of my implants that could ever be done. I'm so grateful to him and always will be. I like to smile, and it's part of my personality to always smile when I greet somebody. I knew that I was going to have a perfect smile for the rest of my life.